Hey, the last 2 years, I have been a paid member of an online education site called MedBridge. If I'm not mistaken, many, many years ago, I was out in Seattle with my good friend Tim Vagan, and he introduced me to some folks who were beginning this website. I think this was them. I'm not sure if they've sold it or moved on, but it's certainly become something very, very substantial. Uh, Now I have to be honest. I have not over the last 2 years. Haven't really looked at a lot, but one of the things that I have seen on there, you're able to use for physical therapy CEUs for some states. So I'm licensed in multiple states. They are available for some states, but not others. And usually it's New Jersey. Shocking that is often not available. But New Jersey has some very, very strict standards for the continuing education that they accept. So you just do other courses, and it's not like you can't find what you're looking for. But back to MedBridge. So I've been a member, and I'll watch some things when I have time. Certainly over the last little while, I've had more time and chosen to kind of dig through all of the different series and topics that they have, and I started to bookmark everything I wanted to see. And without any kind of call, someone gave me a ring from MedBridge asking if to be some kind of affiliate or influencer or whatever it's called. And so from this point, it is I would like it to be known that should there be some kind of interest in MedBridge and you'd like to use the code of Weingroff PT, then I'm gonna get something out of it. But I'm always gonna be transparent. And when I told the young lady what I would do was, because I am paying and they're not comping me on the membership, I pretty much can say whatever I want. And what I can say negative, I can say positive. I think it'd be a horrible, horrible thing if somebody comps you something and then you say negative things. That actually happened to me a long time ago. I think it was 2012 where somebody attended one of my seminars. I didn't really know who they were. If I did, I would not have agreed to allow them to be comped. And then they pretty much buried me in their website blog, which I thought was a pretty dirty thing to do. Not because somebody was right or wrong or people aren't entitled to their opinion, but if you're comped, you either say something nice or you don't say anything at all. Anyway, so in this case, I am not comped by MedBridge. I am a paying customer, and I'm going to talk about one of the recent webinars that I saw that was good for some CEUs in New York and Connecticut. And the first one that I picked was like, oh, I know this name, and this name is Todd Arnold. Dr. Todd Arnold is a physician in Indianapolis, and I met Todd in 2008 when I assisted Kyle Kiesel in an FMS level 1 in New Jersey. And Todd came along, and I think he had just kind of gotten into that model. And what I thought was really cool was that here is a medical doctor that is using this model as part of his initial evaluations. And I think the more people that can talk the same language, lots of really, really good things can happen. So when I saw the name and I looked at the topic, really we're looking at not just differential diagnosis of musculoskeletal pain. It's not just respecting that you can have back pain, but it may be coming from an internal organ. And there's certain things that as healthcare providers we look at. I would also like the non-healthcare providers to be very aware, because if they are so cavalier to messing around and trying to train or even do some rehabilitation techniques for people that have pain, well, at least let's have some kind of baseline knowledge if this pain could be coming from somewhere else that may not be neuromuscular. And some of the things that you might find in a differential diagnosis where the pain does not change significantly with movement, That might be something that could be from internal organ, or what I would call a medical ideology. When you look at things right versus left, sometimes there could be a reason to believe that if it's on one side, it may or may not be medical. Both sides having an idea. I'm very consistent that everyone should know everything. It's just a matter of what you do with that information, and that was a piece that Dr. Arnold's webinar began to talk about. But for the healthcare provider, one that is evaluating for pain, went into significant neurological, significant cardiovascular tests that typically would only be authorized by a medical doctor or perhaps a DO. I'm sure some states are different. Now, during my time in the Marine Corps as a physical therapist, as a civilian physical therapist, we would have the ability to order these tests as well. And so there was a significant experience that I was able to gain on what these tests could tell us and how that could contribute to a musculoskeletal evaluation. And this is really what this webinar is about. Now, Todd talks real fast, which is not so much of a problem because I don't think we're watching this for the purpose of memorizing and knowing everything that he knows. What we're looking for is an awareness that there might be things that are outside of our skill set that can help us get to a solution, and it might be the best solution. Sometimes we still get to the same endpoint, but if you can get to the endpoint faster with information, and now this is really my opinion when it comes to that. When you know what the medical doctor knows in terms of tests, you may not have the legal right to order the test, but now you're kind of at an even playing field with these physicians. And I think a lot of people complain on whether whoever the different players are in managing an individual's healthcare or performance, there's a challenge of somebody pulls rank. Well, I don't think anybody is above anybody. I don't think physical therapists are above athletic trainers. I don't think athletic trainers are above physical therapists. I don't think doctors are above anybody. Everybody is equal. Everybody just does different things. But I think for other people would probably have a different perspective that somehow they are ranking people based on their standards of healthcare and their education. That's not what I'm thinking. But based on the education, you'll probably have the ability to practice things more than the next person, which then makes you the authority. It's not so much the education, it's the education that puts you into a course of what do you practice. When you practice something a lot, you make mistakes. When you make mistakes, you get smart, because you don't make those mistakes again. So learning things of like when you would look to order an EMG, when you would look to order nerve conduction velocity, when you would look at some of the cardiovascular tests in terms of evaluating VO2. Lots of things that Dr. Arnold is talking about gives you a reason to communicate with the physician and say, hey, you know what? We have tried therapy for this long. I think an EMG might be in order. And now, if that physician gives you some flack, like who the hell are you? Well, then you should probably be working with a different physician. A lot of times people will ask me, well, how do you have like these strong relationships with these physicians? And I think a lot of it is starting that relationship with more give, meaning you're going to refer way more people to them. I think as physical therapists or chiros, you absolutely should know if somebody needs surgery. You just don't know how to do the surgery. Even if you take 5 weeks, I tend to think you should need no more than 2 hours, however long that takes. Maybe an hour and a half to know if conservative care is going to be a solution. And to think that we don't need doctors, to think that we don't need what they do is really unfortunate and almost narcissistic. To think that you don't need surgery, to think you don't need medication or injections is very, very poor form. Because what will happen, I think, if you refer somebody to somebody that maybe does something that you don't do, there's a pretty good chance that person is going to remember that you influenced them to go. So that's trainer to therapist or chiro. That's therapist to orthopedic surgeon. They're going to remember that you were the one that kind of put them on that path. And when you have a great relationship with that physician, and maybe you can wrangle some VIP treatment in terms of scheduling, getting a back number, and being treated like the person's family, I think you can get close to that when you can have conversations that are on par with these referral sources. And I think if you watch Dr. Arnold's MedBridge, you'll find that there's a world, and now you can download the slides and start to look at and make some notes of while he's talking that, you know what, I've got a patient that this type of test really might be, and the doctor won't run the test. Well, maybe if I explain what I am looking for from the test, where you're not just going to say, I want this test, doc. But I think you should be able to get to that, by the way. But I want this test because I'm looking for this, this, and this, and I'd like to learn this. And when the doctor sees that you actually know what the test is and you just don't have the button to push to order it, I think some good things can happen. So that's really what I got out of Todd Arnold's MedBridge. So I think you should check that out. Now, let's talk about this Weingroff PT code that you'll see in the body of the message. Obviously, we'll have this in different forms of social media, but at the highest level of the MedBridge subscription, I believe it's a $200 discount. So that's pretty significant. And when you look at if you're a physical therapist, that the CEUs can become substantial for that amount of money. Now, there's other levels of the of subscriptions where they have home programs, and there's a telehealth option. There's some other things. So I'm very favorable towards MedBridge, as I can prove that I was a customer well before they looked to build this kind of relationship. So this is how I'm going to go about promoting that Weingroff PT code for using MedBridge. If I am not a customer of MedBridge, then I'll probably won't do this anymore. So I've got a couple other things that I've already watched and will film and talk about what they are. Now, for me personally, there isn't a ton of information on there because it's for all physical therapists. It's not just musculoskeletal, orthopedics, sports, etc. The other stuff maybe isn't going to be terribly applicable for me and how I value my time, even though I'm sure these are competent at worst therapists. So I'll pick the stuff that looks interesting to me. I'm certainly going to support the people I know and watch their stuff, and we'll come on and give you a review here. I don't think you're going to learn how to do these tests. Dr. Arnold talks really, really fast. But ultimately, if you can sift through and look at the bigger picture, definitely download the slides, and then you have another 364 days of trying to check out a lot of other stuff. Weingroff PT, again, is the code, and I think there's a significant discount in terms of what's available with their yearly subscriptions.